diseases that are unique to women. Take, endometriosis, take menopause, take ovarian cancer. Diseases that are more dominant in women, take the autoimmune diseases, for example, but also Alzheimer's, and diseases that present themselves differently in women, like cardiovascular conditions, for example. So for us, that's the entire spectrum, because men and women are just different, right? And at times we take as an assumption they are the same. And if we look at this entire spectrum and we use the burden of disease, which is the biggest or most comprehensive study on epidemiology, we see that out of 100% of this burden, only 5% is associated with conditions only women. The remaining 95% is associated with those other diseases, right? And for almost, let's say, between 45 and 50%, we don't see a full difference between men and women, right? But for the remainder, we have something like 47% are diseases disproportionately impacting women, and another 4 or 5% is diseases that are different in women. So again, the burden is different depending on the groups.
In general, women's health issues don't get funded as well as other medical conditions do, and certainly not something that's in the reproductive realm of things. And there's a social stigma around aging in particular for women, and some of that is reflected in how research dollars are awarded. We see that all the time.
Menopause, right? A condition that will impact all women. All women will go through the transition, right? Menopausal transition. I think around 80 to 90% will experience symptoms. We see data that shows for 100 menstruating women, only 30 then are in menopause. And you're like, where are the other 70 gone? Right? They surely have not all died in between. And so there is a significant misrepresentation because there is limited diagnosis. There is limited also coding in the system of having provided care to women. And so it creates a false perception. That's why this famous 5% I referred to earlier might be a significant misrepresentation. We've seen a similar, actually, delay in diagnosis or delay in care in other conditions. Take diabetes. It takes longer, right, according to our data, for women to be diagnosed. If you take cardiovascular diseases, women who have had a heart attack are more likely actually to die after being discharged than men, right? And again, it's a question of we have taken a lens that has not been tailored to the uniqueness, right, of the female body and apply the same concept that has worked for men.
It builds community. It allows people to see that they're not by themselves. It destigmatizes it. It gives people a voice to share their experience and compare and contrast with other people, especially if you've tried to seek help from a healthcare professional and maybe felt minimized or didn't feel heard. It's empowering to have this community of people. And it's a great way for education purposes. We utilized it for the MAP study. We were able to recruit participants. So it's a nice way to broaden your research reach as well in a way that we hadn't been able to do it in the past. I think really that social media has been a huge factor in really bringing menopause and midlife and aging women's issues to the forefront in a way that people are saying, hey, this isn't my mom's menopause. Like I don't want, it's not a taboo topic. And I want information. I want to know how I can be my best self. And I don't want to just be, I don't want to ignore it or push it under the rug. To be able to do an international study with not a lot of resources, but to be able to get, the amount of response that we got in such a short period of time, I think lends itself to the time that we are living in right now.